Welcome to CRG. Thank you for joining us virtually today. We're happy to have you join us for today's webinar, Supporting Your Child or Adolescent in These Uncertain Times. I want to introduce myself. I'm Dr. Julie Steck, and I'd like to introduce my colleagues, starting with Dr. Norris.
Hello, my name is Dr. Sarah Norris. Good to be with you today.
I'm Dr. Tremaine Presley. Happy to see you all.
Hi, I'm Carolyn Kruger. I'm a psychiatric nurse practitioner.
Thank you all for being here today, and I will start off today by talking about our goals. First of all, we decided several months ago to do this webinar because we knew that many families were struggling with the stress of uncertainty, the stress of changing schedules. And so we wanted to be able to try to address some of those, some of your concerns. So we have several objectives today. One, we want to clarify the intersection of stress, anxiety, and depression. We want to describe the forms of anxiety that present in children and adolescents. We want to discuss the roles of therapy and medication in addressing anxiety, and identify the top 10 things parents can do to support their children and adolescents. Here we go. So this is one of my favorite YouTube videos. I think during this time, we've all had a little more time to try to find humor. I've certainly watched more YouTube videos than I have in my whole life. And this is one of my favorite videos. I think this young girl expresses how we're all feeling. It's not very clear, but I think you can get a sense of the stress she's feeling.
Now everything in this world has to shut all the way down, so nobody has to go anywhere because they're shut down. The ice cream truck is shut down. And the water truck place is shut down, which is like my favorite one.
So I know you might not have been able to hear this young girl, this 4-year-old girl talking, but she was talking about all the stress she's feeling because everything shut down. The water park shut down, the ice cream store is shut down. You can't even go into McDonald's to get your hamburgers, and it takes too long. She likes to play. I think we're all feeling stress. We're feeling stress due to the COVID and the racial injustice. We're feeling stress from changing schedules, from us having fewer outlets. I think disappointments have been large. Things we've looked forward to, we've had to miss. So we know that stress can precipitate anxiety, and anxiety can precipitate depression. And I think we know that the stress, the anxiety, and depression are affecting everyone. What we also know is that anxiety is a common emotion in the normal human experience. We're programmed to feel some worry and anxiety, and certain forms of anxiety are developmentally appropriate. So it's typical for an infant to have stranger anxiety. It's typical for children to go through separation anxiety. It's typical for toddlers to have fear of monsters and the dark. And we know that adolescents go through periods of shyness and self-consciousness. But in today's time, we're seeing anxiety, stress increase at all ages. Uncertainty increases stress and anxiety. So what are symptoms of anxiety? Well, there are many. Excessive worry, irrational fears, discomfort with others looking at us, physical symptoms such as stomach aches, and bowel problems, difficulty separating from familiar people and going to unfamiliar places, perfectionism, panic, compulsive and repetitive behaviors are all symptoms of anxiety. Anxiety takes numerous forms in children and adults, but we actually know that for most individuals, anxiety has a median age of onset at about 11 years of age. The lifetime prevalence of anxiety is high, about 32% in adults, and a yearly prevalence of about 19%. We know that anxiety is much more likely in females. 23% of females experience a lifetime prevalence of anxiety, while only 14% of males. But we also know that we are seeing increased rates of anxiety and depression, especially in teens. This is a study, and we've attached a copy of this flyer to the webinar. We know that youth were very aware of mental health problems prior to COVID, but now about over half of teens are saying they've experienced anxiety in their lifetime, but even more now. 43% of adolescents say they've experienced depression in their lifetime, but at even higher rates now. So when we talk about anxiety in children and adolescents, we know that it can take many forms. We can have adjustment disorder with anxiety, which are brief periods of anxiety caused by certain incidents or conditions, possibly the loss of a friend, a move, a significant but short-lived trauma. We can have separation anxiety disorder, which I have a feeling we're going to see an increase of when children have to separate from their parents after being at home for a time. There's generalized anxiety disorder, which is probably the most common form. It involves a lot of what if thinking, worry about the future. Social anxiety disorder, specific phobias or fears that can be very debilitating, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, and somatic symptom disorder. That's when you have a number of physical symptoms that are caused largely by stress. So what are the takeaway messages about anxiety? Well, one, anxiety disorders are common. The onset is usually early, usually by adolescents and people who are going to continue to have anxiety disorders. The condition is often chronic without intervention. And we know that the rates of anxiety, depression, and stress are much higher during this period of time with the coronavirus, and also awareness of social injustice. And we also know that the tendency to develop anxiety is very hereditary. So there's a highly hereditary component to anxiety. So we're going to spend the next part of this presentation talking about treatment of anxiety. One, I think treatment starts with recognizing the symptoms of anxiety in your child or adolescent. Recognizing when the behavior is not just normal childhood behavior, but is representing a form of anxiety or depression. The second part of treatment is to provide support and consider therapy. And the third prong is to consider medication. So with that, I'm going to turn my mic off and turn this over to Dr. Tremaine Presley to talk about coping with anxiety.
Thank you. All right, so as Dr. Steck has mentioned, right, I think with our recent climate, right, there's a lot of social, racial, and political changes that are being made. And specifically, we know that members from the Black and Brown community, they are experiencing what we call racial trauma or a lot of race-based stress. And so when we're talking about racial trauma, we are talking about the reactions to the dangerous events that have happened that we're perceiving on the news or on our social media news feeds, and so experiences with real or perceived racial discrimination. And so as a result, individuals from these communities, they're having reactions, stress reactions to these different events that are happening. And so it can take place it manifests itself in very many different forms. Some of it is hypervigilance, some of it is heightened sensitivity. So being very sensitive to messages that portray a level of disrespect or convey inferiority or invisibility. Changes to our emotional functioning. So, whether that be anxiety, whether it be depression, a sense of hopelessness or helplessness, physiological symptoms. And so some individuals might experience, body ailments, headaches and stomach aches, changes in their adaptive functioning. So those skills that we need every day to function on a day-to-day basis. So relationally, academic or occupational functioning, as well as changes in sleep and eating patterns. So all of these things can contribute to the reactions that one has in response to stress when stressful events, especially race stressful events are occurring. In addition, members from the white community, right, are experiencing stress as it relates to, the racial protests, as it relates to like allyship and activism. A lot of parents that I've spoken to, are having stress related to how do I have this conversation, this difficult conversation with my child about allyship and activism and everything that is appearing in the news. How can I practice emphasizing social justice, inclusion, and human rights? And so, I think, when I say, waking up to racism, it's everywhere. It's being talked about everywhere. And so parents are having reactions as to, what do I need to do to have this difficult and challenging conversation? And so a couple of things to consider when wanting or needing to have this conversation is parents needing to take care of themselves first, right? It's kind of that whole idea about put your oxygen mask on first, right? Manage your own anxiety and emotional reactions to the things that that you're coming across in the media. You can't have a conversation and organize your thoughts accordingly if your emotions are all over the place, or if you lack an understanding about what's going on. So take time to manage yourself first. But then I think part of that too is allowing the developmental level of your child to guide what is it that you need to do to have this challenging conversation. And so we know that with infants and toddlers, right, they lack the understanding about what's going on. They have no clear understanding or insights about, the events themselves. However, but what they do pick up on are the emotions of other people. So, they watch, how you regulate your emotional response in response to the events, right? And so they're looking at you. So we want to make sure that we are managing our own emotional reactions, but also being intentional to present Brown and Black children in a positive light, right? And so again, you want to do that with more infants and toddlers, and not really, obviously you're not going to have a deep, engaged conversation with your infant or toddler because they lack the understanding, the cognitive understanding of these events themselves. We know that preschool and elementary children, that they ask a lot of questions, right? They're starting to become curious about differences. They start to become more aware of differences. And so one, we want to limit the exposure to children at this age to the media as much as we can. And so that's also not saying we want to shield them from what's going on, but sometimes the media doesn't present the most accurate depiction of actually what's going on. And so as a parent, you want to stand in front of that and be proactive to engage your child in conversations, right? You want to engage them in conversations, educate them in conversations, and not allow for social media or the television or the news to educate your child about the current event. Setting screen times, co-viewing the content with them, but then finding activities outside of, that are not media related, arts and crafts, purchasing age-appropriate books or shows and videos that actually depict peaceful protests and why individuals or groups of people are protesting. Middle school and adolescents is a little different, right? So now they're beginning to develop more of a cognitive understanding about, okay, what's going on? And they're like, okay, we need to do something about it, right? We're seeing they're able to actually cognitively understand how these events actually impact them. And so they might have a much more different emotional reaction to the events themselves. And so with that, I think it's important that in this stage, we actually have very intentional conversations with them. We want to utilize movies and documentaries. We want to help to intellectualize the events, right? And so intellectualizing also means that we have to have the knowledge base behind some of these events, accurate knowledge base behind some of these events. And I think, with this day and age of social media, it's this whole concept of like online activism, right? How can they use their social media platform in a way that helps them to become an activist for these sorts of issues? And so, we want to encourage our children to be self-expressive. And I think now a lot of children are using social media in that way. And so, it's the parents really guiding them to do that. And so those are just some of the things that I think come to mind when I think about, how to engage your child or how to help to reduce the anxiety and the stress related to this topic of conversation. In addition, coping with stress and anxiety. So, the way in which I work in practice in terms of, helping my clients deal with or manage stress and anxiety, I'm very cognitive based in that, and some behavioral, but very cognitive based in that I believe that the mind is a powerful tool, right? So we know that as increased awareness of our thoughts and our thought processes, we can get a sense of control over what we think about, and we can actually do things to change the way that we think. And so a couple of the things that we'll go through today, one being attentional shift, right? And so we have the ability to shift our attention from one stimulus to another, right? And so because our attention is so shiftable, we have the ability to choose what and where we're going to set our focus, right? So everything that catches our attention doesn't deserve our sustained attention. We can actually shift our attention where need be. Reappraising the situation. Reappraisal is a psychological strategy that can be used when events become too stressful, right? And so what it does, it involves reframing the perspective to lessen the emotional impact. And so I find that, obviously the younger the child, the more help and assistance they're going to need from their parent. But it's really being able to say, let's take a step back and reframe the way in which we're looking at it, because as you all may know, looking at things from a different perspective might offer a different and more effective solution. Being able to insert logic and reason in your decision making. I always try to encourage my clients to examine the facts of the situation. Emotions do not really grant us the ability to be factual or rational based. Emotions are here and they're there, they're up, they're down, and there's a very irrational component that is often associated with emotion, right? And so it's really our human ability to attach fact and logic and reason to our emotions, right? Want to help to make sense of them, or if they don't make sense, let's throw them out. So it's important that we're able to insert logic and reason in our decision-making process so that we're able to make decisions according to the problem, right? Not the exacerbated problem, right? But the actual reality of the problem. The next one is the mindfulness practices. So relaxation practices. And so we know that grounding techniques are beneficial in helping us to stop those negative spirals, right? So deep breathing, right? As we inhale new information, right? We're always taking in new information. So being able to do things like taking deep breaths, noticing sounds and sights and smells within our current environment, that helps us to stay in the present, in the here and now. Because I always say anxiety is a very forward thinking, right? It's always anticipating what's going to happen next, and it misses everything that's happening currently. And so, you know, deep breathing, being aware of sight, smells, and can also help. Spiritual practices help, also listening to music and giving those things all of your attention. Developing an attitude of gratitude and kindness. And so when we help others, just naturally, right, our brain releases these neurotransmitters called oxytocin, serotonin, and dopamine. And so this trifecta of chemicals, they actually boost our mood, but then what it does is it counteracts the stress hormone, which is cortisol. And so, you know, just naturally, you know, getting out to do something nice and helpful for someone else, that actually helps us in turn internally. Opportunities for exposure. So naturally, when people are afraid to do something, the first thing we do is we want to avoid the thing that we're scared of, right? And so because our body goes into this fight or flight mode, right, our mind is then infiltrated with all of these irrational thoughts that supports that feeling, right? And so it makes avoiding justified, right? It makes it realistic. Of course I'm going to avoid, right? Why would I, you know, approach the things that I'm scared of, right? However, research has shown that exposure to the fear objects, activities, or situations in a safe environment actually can help to reduce the fear and decrease avoidance, also known as anxiety and stress. Writing about it, my clients hate writing, so if they're on here, they're probably laughing, but they hate journaling about it. But we know, and research has shown, that journaling has been very beneficial for a number of things. But when it comes to anxiety and stress, you can identify your stressors this way, and that allows you room and space to actually identify a more effective solution to the problem or to the trigger of how you're going to cope with that trigger. Journaling also helps you to slow your brain down, right? And so we feel and we think, and we have so many thoughts attached to that one feeling, anxiety or stress, and it just kind of keeps spiraling, right? When you're journaling, writing actually slows your brain down just enough so you can get it down on paper. And so it's important that with children, smaller children, if they're not able to write, encouraging them to draw, right? Drawing out their worries and their anxieties, and then composing maybe like a short narrative about the actual picture. The power of self-talk. And so self-talk, talking back to your worries. You know, sometimes I get clients where, you know, their anxiety speaks to them so loud. And so there's this internal voice that actually, you know, just it reinforces all of the fear and the anxiety and stress that we're experiencing. And so we want to encourage your child to say something back to your anxiety. And so the next time your child expresses a worry or, you know, a stress, you want to ask them, you know, what would you want to tell that worry, right? Have them practice speaking out loud to their worries will actually help them to identify rational and helpful thoughts. I think that's really important. And then last couple of things, just using books and other forms of media. There are a lot of apps to download that can help with stress management. And then just empathizing and validating, right? And so children are humans and they experience anxiety and stress just like adults do, maybe different, but it's all anxiety and stress. And so we want to empathize and validate their emotional experience as well. And so part of that, you know, sometimes, you know, individuals do need to enter into, you know, a more therapeutic process and individual psychotherapy. And so we know that with individual psychotherapy, it is aiming to alleviate those internal distress, right? Help to improve those relationships, and just the overall emotional and behavioral functioning of your child. And so CBT is a very, evidence-based practice treatment model that is used to treat anxiety disorders. And so therapists, they, would be working with your child in using this technique or using various techniques that come or derive out of the CBT model. The younger the child, usually parents are more involved. And so the idea, I think, I love CBT because it's very skill-based and it's very easy to do at home. And so, being able to provide opportunities to practice these things at home is important. And so when we're, when to consider therapy, I get that question a lot too, like when should I, put my child into therapy? When is the disruption to their functioning? I say children, they need to feel successful. They need to feel like they have a good handle on things. And when they don't feel very good about themselves, just as any human being would, right? And so when it's starting to cause disruption to their ability to like sleep and have friends and like work at school or, get their schoolwork done, then something is bothering them and maybe we might need to consider some professional support. In addition, just a change overall in their mood and their behavior that lasts more than 2 weeks or more, and is actually reoccurring. Excessive fear and worry can be very difficult to control, right? And so when it becomes too difficult to control, and it's starting to impact their ability to sleep, or they're getting so many stomach aches or headaches and they are not getting good rest at night, we might need to consider professional help. And then also in disrupting their interpersonal relationships as well. Okay, so next it will be nurse practitioner Carolyn Kruger discussing medication as also another treatment option.
Okay, hi everybody. Thanks, Tremaine. I'm Carolyn Kruger, a psychiatric nurse practitioner here at CRG. We have 4 medication prescribers here. We have Dr. Lewinsky, Dr. Rowland, and Megan Skelding, who's also a psychiatric nurse practitioner. So a lot of parents are very worried about medication. What I should start with is saying that we don't just want to throw everybody on medication. We don't take the decision to put children on medication lightly. And we don't just throw pills at every issue. So what we're proud of here is doing a really good assessment, get a thorough assessment and a proper diagnosis with the wonderful psychiatrists and psychologists here. And then when we have the appropriate diagnosis, for example, anxiety, we have the ability to rule out depression or rule out concerns with bipolar. The initial intake here at CRG usually involves the child's developmental history and medical background. And we dig in and review, were they born prematurely? Was your child in the NICU and needed physical therapy, occupational therapy, speech therapy? Do they have developmental delays that have sort of contributed to them being behind their peers? And part of the history includes the parent's history. So we like to examine biological mom and dad, if known. Do they also have a history of mental health issues or issues with anxiety or depression or attention deficit disorders? Neurotransmitters, so medications, how do they work? What are they? They're chemicals. They actually fire away on our neurotransmitters and they sort of turn up the volume. Think of like a cell phone when you go through a bridge and you have the signal dropped. You can't hear, the call gets choppy or it hangs up. When we improve the neurotransmitter signal, it can pump out more or dial down and kind of adjust how that person is feeling. A shortage or an excess is thought to be responsible for many mental health disorders. And there are presently over 100 neurotransmitters in the brain. As we see on the next slide, the ones that we work mostly with related to anxiety are dopamine, norepinephrine, and serotonin. So dopamine, and this is a quick overview. Just go back one slide, please, Julie. There we go. The dopamine controls, just go back one more slide. There we go, right there. Controls movement, emotional responses, and the capacity to feel pleasure or pain. Norepinephrine ties into regulation with our blood pressure, our alertness, hyperactivity, and anxiety. And serotonin is the main medication that we typically start with. By adding more serotonin, we usually look for an improvement in behaviors such as sleep, mood, pain, appetite, peristalsis, and vasoconstriction. That would relate to those stomach aches that maybe your child has when they're nervous, or those headaches, or that muscle tension when they don't feel good and they don't want to go to school. There are many subtypes of serotonin that can be tweaked in relation to treatment with anxiety. Next slide, please. So our goal, if you or your child is diagnosed with anxiety, typically the first line of treatment is to add an SSRI, or serotonin reuptake inhibitor. What that ultimately does is turn up the volume on the serotonin. And serotonin, as you take that medication, typically 1 time a day. We want you to take it every day, the same time, and it's going to take 4 weeks. Typically 4 to 6 weeks is what we tell people in order for them to see an improvement. So it's not like you have a headache and you take ibuprofen and maybe that headache goes away in 45 minutes and then you don't have another headache. With this anxiety medication, you need to take it daily. It needs to build up in your system to a steady blood level, and we need to keep the signals going routinely at the same time of day. And what we do, the goal with the medication is to reduce that low mood or to reduce that intense anxiety. We want to prevent those panic attacks that have gotten more frequent and are prohibitive to maybe your child going to school, leaving the house, sleeping in their own room at night. We want to decrease the avoidant behaviors or decrease the re-experiencing or stressful event. Mostly dial down that hyper-arousal. So parents ask me, how long should I have my child on this medication? Say they're doing better, 4 weeks in, we've got them on a serotonin agent, the child looks like they're doing better. We've dialed down the anxiety. How long? Should they go off of it? No. What we want is typically, and it's going to be specific for each case, but I always just say real broad, do 6 months to a year and see how your child does. Routinely, patients get on a medication, they feel better, and then they say, hey, I don't need it, and they stop it. You don't want to just stop a medication because a lot of people will have withdrawal syndrome, and then they feel really bad 4 or 5 days out when all the medicine has washed out of their system. So common selective serotonin reuptake inhibitors, Celexa, Lexapro, Prozac, Paxil, and Zoloft. And we all, when we do our med history, go to the new prescriber and say, I was on something years ago, and we all forget, and we don't remember what it was. So my joke is it was a little white pill. One thing you can do if you know that you're going to an appointment and you know you or your child tried a medication 2 years ago, you could call your pharmacy and just check in. What was I prescribed? What was the date? Who prescribed it? The starting dose? And then look back at your history and say, okay, what did I end up? Did I stay on 25 milligrams of Zoloft and then go up to 50 and then 100? Or did I stop it after 25 milligrams? So ultimately, the medication selection is going to be based on a proper diagnosis. We prescribe different medications for someone diagnosed with anxiety compared to someone who's diagnosed with bipolar disorder. So we want to start at the foundation with a good, proper, thorough diagnosis. We look at the history. Perhaps your child tried a medication when they were in elementary school, they went off of it. They tried a different medication and they went off of it. We like to dig in and say, why? What happened? Were there side effects? Was it a bad fit? Did you have issues, or was it a good fit and then you went off of it because you felt like you were doing better? Another important point is family history. Oftentimes families don't discuss their mental health background. Moms and dads typically don't share with their children, an example of postpartum depression, or if dad had an anxiety disorder in high school or college. And I understand that it's embarrassing for a lot of parents. They don't want to share that or create worry in their children. But I encourage parents and children to have discussions. If a parent has been diagnosed with anxiety or depression, chances are that their children could experience those types of diagnoses sometime in their life. And I try to tell parents it's okay to share your history, because you're going to model to them, like, hey, if you need help, if you broke your arm or you had diabetes, you'd go to the doctor and get it treated, and see an improvement and move on. So good self-care is discussing family history. The other thing I listen for is, did you have a relative, in my family, crazy Uncle Larry, and maybe we just thought he was crazy, but hey, maybe he had mental health issues. Maybe he suffered from bipolar, or he suffered from anxiety or depression, so he didn't leave the house for years, or he had behavior that now we look at and we could diagnose, whereas our grandparents didn't seek mental health help, perhaps, when they should have. We look at other meds, pre-existing or conditions or comorbid diagnoses. Do you have other issues? Does your child have other diagnoses and medications, and or other pre-existing conditions? A lot of times kids are young and healthy. They don't have a lot of issues. But as people get older, they have more issues like high blood pressure, diabetes, or thyroid issues. And then the other part of it is good old-fashioned trial and error. Sometimes a medication that works really well in an 8-year-old might not work well in the 9-year-old brother. So sometimes we just have to try and see. And I will say a part about genetic testing. We use Genomind in this office, where it's just a Q-tip swab in somebody's mouth. We send it off, and then usually 7 to 10 days we get back a report that will show what typical psychiatric medications you are predicted to metabolize well, and meds that you may have an issue metabolizing. I find it helpful. Sometimes clients say, well, the report might say I should be on that med, but I don't want to take that. I took it before, I didn't like it. But a lot of times it's a helpful guide for prescribers to say, okay, genetically, there are meds that you are more likely to metabolize and have a benefit from versus others. So we can use that as a guide. Also, there are sometimes supplements that we can add to medications. If you've been on medications that worked well and then they stopped working, that's called poop out. Sometimes if we add certain supplements, you'll see an improvement in your own neurotransmitters improving, and you'll get the benefit of the same medication being more effective. So a thing I like to say to parents also is that we understand medication's not for everybody. As Dr. Presley mentioned, culturally, different cultures seem to have patterns of being more comfortable seeking mental health care and seeking medication. I worked inpatient at the stress center for years, and culturally, some cultures I never saw children being admitted. People from the Indian culture, I never did see children with parents from India being admitted for mental health issues. There was a much lower rate of Asian families with a child being admitted to the stress center. And certain cultures attribute more belief in prayer and religion than seeking out mental health with prescribers or counselors. So we understand that. And I have had more than one meeting with parents that they want to meet to discuss options and we'll say, well, we want to hear what you have to say. What would you prescribe? What would that look like? And we discuss it. And then they don't have to agree to put their child on that medication. We understand that parents are worried and parents are concerned. Another question I get frequently is, my child then going to be more predisposed to use drugs, illegal drugs or illicit drugs, if I put them on medication for anxiety at a young age? No, actually studies have proven that if your child has a disorder and they're not doing well, and they can't go to school, they can't sleep in their own bed, and they always feel wound up and anxious, they don't do as well in school, and they tend to not finish school. They tend to self-medicate more to try to soothe themselves. So do they need to be on medication? Talk with your prescriber. And do they need to be on it forever? No. People outgrow things. With great counseling, they can make new behavior patterns. Like Dr. Presley mentioned, so many wonderful coping skills can be taught. When we dial down the anxiety, they're able to do the work of working with their counselor and their psychologist to form new coping skill habits. So definitely the best approach that we see is counseling, and then medication, and then a plan to move forward, and then consider, okay, should we go off the medication? Should we do a trial? Can we end it, by a certain time frame and see how it goes? And then you reassess, and if you need to go back on or tweak them, we sure can. Next, we're going to talk to Dr. Norris about the top 10 tips for parents. Thank you.
Thank you, Carolyn. And we're going to kind of go down from 10 down to 1. I think one that's really important is to provide information geared to a child's age and developmental level and maturity. It's important to be concrete and honest, and I think with adolescents especially, to avoid scare tactics, as that will likely backfire. Children and adolescents usually can handle the truth, but they're pretty unforgiving if they feel that parents have not been honest with them or they've actually lied to them. It's important not to make false assurances, this will never happen to our family, because I don't think parents can predict that right now. And I think it's important to end that discussion with the reassurance that parents, teachers, community members, everyone's going to do the very best they can to try to keep them safe. And their job as kids or adolescents is to pretty much follow the rules, whatever those are established at school or in the community. Number 9, establish or continue a warm and nurturing bedtime routine, even for teenagers. And you think, oh, for teenagers? Well, anxiety often peaks at bedtime, and children and adolescents may need that extra support. Teaching breathing exercises, some of the things Dr. Presley suggestions can be helpful. There are some apps, but that structure and consistency is really reassuring to the young children. It's a time to get their questions answered. Continue reading to kids if that's been your pattern. They may need extra time at this point in their life. If they're young children, it may be helpful to read about children's fears and upsets, like with books such as available through like Sesame Street, Bernstein Bears, Mercer Mayer. The library may be able to recommend more sources. And some children may be reassured from a younger time in their life. If they really are feeling anxious, even your adolescents may haul out a favorite stuffed animal, a blanket, a book from an earlier time, or even want to play a game or watch a favorite movie that maybe you haven't seen in several years, but that is very reassuring to them. It's really important to try to really listen to their fears and worries. We're not quite there yet, Julie. Sometimes parents have an idea what kids are worried about, and it may be very different than what they think. Parents may be very worried about economics or safety, and are not and they can't even think about what their child might actually be worrying about, such as like they missed a birthday party because of the COVID. Their parents wouldn't let them go. Then they worry, you know, maybe my friend won't like me because I wasn't able to go to the birthday party. Sometimes their worries may be more global, way beyond what parents even think about, such as worrying if there's going to be enough places to bury people because they're seeing things on TV with the amount of people that are dying from the COVID. And actually, that's a worry I had when I was about in 3rd grade. Was there going to be enough space in the world? So now it's time to change that slide, Julie. Thank you. So monitor their diet. As too many carbohydrates, calories can cause stress eating and obesity. And also, if you have too many carbohydrates in your diet, you may feel really sluggish and be prone to irritability and depressed mood. So it's really important. As parents, you may see too much eating or too little, because lack of appetite can also happen. It's important to provide physical outlets and model an active lifestyle if you possibly can. Try to get outside at least part of the day. Just remember and think about your own life. I bet you remember the parent that played with you, and you want to be that parent that your child remembers that took the time to play with them. And like I said, they may want to do things that maybe are from an earlier period in their life if they are feeling particularly anxious. Encourage support from extended family or friend networks, even if that has to be virtual. Older relatives can sometimes give new perspectives on things. Also, particularly with the COVID and people being home more, children and adolescents may have more patience with grandma and grandpa or other family members to tell stories or look at scrapbooks about their family. Or they may be interested in putting a scrapbook together about their family. Or maybe they're willing to organize your photos in your computer. But I think this helps them feel connected to their whole family system. Okay, Julie, you can change. Thank you. Monitor screen time, enforce limits, whatever, appropriate to the family values and age and maturity. I think too much screen time can contribute to just kind of some irritability. I think that's true for children, adolescents, and I think it's even true for adults, because adults have had to be doing work through virtual means, and I think that does lead to irritability and some depression. So it's important to have time that you get off the screen. And number 3, encourage creative outlets, and again, I think that can go into doing some things such as scrapbooking and so forth. Drawing, painting, listening to making music, and reading about individuals who have faced challenges, including sports heroes, media figures, war survivors, religious members, may help put the current stress into context. Some favorite books I have for the school age kids are the Roald Dahl books, such as James and the Giant Peach. There's a whole series of those that have child characters facing challenging circumstances. Harry Potter books certainly have that same kind of model. Possibly characters in the Hunger Games for older kids. And Bible stories have numerous heroes and heroines. And I think it's helpful for kids to read about other people that have faced challenging times. Okay. And remind children and adolescents of other times they've faced adversity and anxiety, and how they successfully were able to handle those stressors. What were those previous challenges? What did they do? How did they come over them? What resources did they use? What resources do they need now? And that I think they need to be reminded sometimes about other times that they've faced difficult times. Okay, the next slide, please. The most important thing a parent can do, and again, this I think echoes Dr. Presley and Carolyn's report today, is to address their own anxiety and stress level so they can model good coping behaviors. Remember, parents are your child's best and first teachers. and they look to you as to how to handle information. Help is available. Most therapists nowadays are offering telehealth, so people do not even need to leave their home. So it is available. But if a parent is feeling very, very stressed and having a difficult time providing a good model for their child, then I would suggest that they seek mental health services. Next slide, please. And this again is echoing pretty much what Dr. Stack, Dr. Presley, and Carolyn have said. If a child or adolescent anxiety appears overwhelming, interfering with daily functioning, adaptive skills, school functioning, social relationships, it's time to seek additional help from mental health professionals. At this point, I am going to turn this back over to Dr. Stack. Thank you so much. Okay.
So if my colleagues would turn on their camera webcams and mics, we do have a few questions. The first one I think will really be, Carolyn, directed to you. And this involves the possibility that SSRIs may interfere with normal sexual feelings, development, and so how do parents reconcile that in making a decision about whether to use an SSRI medication, and how do you talk to your adolescent about that?
I'm sorry, I just lost my camera. So the question was, what do we do about a common side effect of serotonin reuptake inhibitors? That common side effect is called anorgasmia, when people have difficulty achieving orgasm. So the older serotonin agents, that was a common complaint. A common complaint was, hey, in adults, it's ruining my sex life. That's no fun. I feel better, but now it's ruining relationships in the bedroom. So newer medications, there are newer medications considered anti-anxiety meds or antidepressants that are built a little bit different on different serotonin receptors. And there are a few that don't have that side effect. Typically, insurance, who wants to say how much they're going to pay for things, will say, hey, we want you to try the less expensive meds, the first line, the Prozac, the Zoloft, the Lexapro. And many of those are now $4 generics, and they do work well at dialing down anxiety. But if you're a little bit older or you've had experience with those medications and they weren't a good fit, a good thorough discussion would then be newer options. There are newer options. Vibrid is a newer medication that when clients take it, they report that it does not interfere with orgasm. And I'll say this, as kind of an old nurse, when I worked at the stress center, I had in 8 years, I had one very honest client who was 17, and he came out of the shower and he said, Carolyn, can I talk to you? I said, sure. He said, well, Carolyn, I'm 17 years old. I masturbate in the shower every morning and something's wrong. So I said, yeah, I think I know your medication is interfering, isn't it? And he said, yeah, what's the deal? I said, well, that's a side effect of your medication. And some people will say, hey, that's a deal breaker. Other people will say, hey, you know, that's okay. I'm feeling better. So you can talk about it with your prescriber. I'll say this, oftentimes parents don't discuss masturbation with their children, but part of the meeting that when I meet with kids like school age or high school kids, if I feel like they admit to having a romantic life and I feel like they can handle it, I'll bring up, hey, this is a common side effect. And, you know, that's kind of part of sometimes allowing your prescriber to meet with your teenager in private so that they can talk about things. They're not talking about you. They're talking about how much weed they smoke and do they have a romantic partner, to be quite frank. Hopefully I'm not offensive here.
Thank you, Carolyn. I think we have time for one more question. And I think, Dr. Presley, I'm gonna ask you to respond to this one. My daughter is 8, and she has been increasingly reluctant to leave my side during the COVID-19 pandemic.
Yeah.
If she is to go back to school, how can I help her with that?
Yeah. And so, you know, I know school is right around the corner, but I think that when it comes to children who are having a difficulty separating from their parent, I always try to encourage those parents, let's start early, right? Now we're running up against the grain of time where, you know, school is either happened or is getting ready to happen here in the next week or two. And so, you know, I think part of that is to help validate and normalize her fears, right? So she's been probably with her caregiver or parent since, you know, we've been home, you know, full time in March. And so it's pretty understandable why she would have a hard time separating from her parent. But then two, it's how can I start to gradually, right, in a safe way, gradually expose her to the school. And so even though you can't go inside the school, maybe taking trips to the school, talking about, you know, effective ways in which she is able to kind of cope with the anxiety. Is the anxiety about, you know, something's going to happen to mom if I'm not there? Or is the anxiety about, you know, being with mom helps to keep me safe? Because, you know, I think zoning in or trying to hone in on exactly what the source of her anxiety is, you can develop an effective plan that way, right? And so, you know, maybe getting together, connecting and talking with other friends to kind of help say, you know, you have some support. It's not going to be just you, is important as well. And so those are just a couple of things off the top of my head that I can think of.
Thank you all. I want to thank all of you for joining us today. I'm sorry for a few little technical glitches. That's what they get for having someone on Medicare running this. But I want to thank our panel today for joining us, and I hope that all of you have a safe reentry to whatever the new normal is going to be in your family with the opening of schools. We are here. We will probably do another webinar in another month or two to address the new normal as we see it then. But thank you all for joining us. Have a good week.